Well, good morning and welcome to the Great Therapist Transformation. So, this is a program that we're going to run mainly in my resilience-based psychotherapy group, which is a group for therapists that looks at how we support children and families during really tough times. I'm also streaming it to my business page and my personal profile, and so we might get some questions and comments from some different areas, but we'll just manage as we can. I'm also in my office, and Mondays is a day that Grizzly is in the office with me. So you may see her walk around in the background. I'm hoping she doesn't bark, but if she does, we'll just have to go with that. So let's get started. I'm going to share my screen and we will look at this transformation. So this is something that was really important for me to do because a lot of therapists are struggling right now and really having difficulties with the impacts of the pandemic and the impacts on our clients, which there's really significant mental health impacts, but there's also impacts on us as individuals as well. So it's just been a really tough time. A lot of people, a lot of therapists are struggling. And I just thought it would be a great time to kind of rejuvenate and have some content that would help us kind of move forward, go back to some of the basics that are really helpful in building our own resilience. So let's get started with the Great Therapist Transformation. So we're in week 1. And there's going to be 4 weeks. I'm going to go live on Mondays, and we're going to take one piece. We'll talk about this a little bit later. We're going to take one piece of interpersonal neurobiology, look at a deeper dive into how that fits into our practice and how it helps us build our own resilience. But today I'm also going to talk about some of the thoughts that a therapist has when they feel kind of fearful or they feel kind of like they're not as effective as they should be, and how to transform those into being a calm and confident therapist. So in case there's a lot of new people in the group, I'm Dr. Barbara Woods. I'm located in Manitoba, Canada, which is Treaty 1 territory of the Anishinaabe, Cree, Dene, and Dakota people in the traditional homelands of the Métis people. So I am in private practice and work primarily with children, teens, and families impacted by trauma, specifically a lot of intergenerational trauma, and have also specialized in supporting Indigenous communities and clients. So I've been an expert witness in our local family court systems for both children's trauma and intergenerational trauma. And I've also developed a 3-phase approach for treating intergenerational trauma that's based on polyvagal theory, interpersonal neurobiology, child development, and family resilience. So today what we're going to look at is moving from a fearful therapist to a calm, confident master therapist. And we're going to look at differences. There's a spelling error that says tearful therapist, and maybe that is a Freudian slip that it's actually tearful and fearful, because it's really hard. We're working with some tough cases. We're working with things that are really difficult in a normal stretch of history, but with the pandemic, everything is kind of made worse. So looking at that transformation between a fearful or tearful therapist to a calm and confident therapist. We're going to look at this through the lens of resilience-based psychotherapy, which is a combination of that interpersonal neurobiology and polyvagal theory to support our own transformation. And again, in that intergenerational trauma program, those are 2 of the pillars, and there's a total of 4 pillars. So the child development and family resilience is along with this resilience-based psychotherapy foundation. So week 1, which we're going to talk about therapeutic presence. And that's that first pillar of being a calm, confident therapist and how we use that in difficult cases. But first, we need to look at the thoughts of a fearful therapist and some of the common things that we experience when we're not really at our best or serving people at our best or feeling confident about that. So you may think, I don't have enough experience. I haven't been doing this long enough. This is a totally different case that I have no idea how to treat. I have to find the one best intervention and master that and use it over and over. Thinking that the therapy technique is the most important. I have to get this therapy technique absolutely perfect for it to work. I need more confidence to be effective at being a therapist. That's a really common trap that a lot of therapists experience. And we're going to look at how confidence is related to being a master therapist, but it's not how you think. And then the last one is I may not have the qualities or strengths to even be a great therapist. Like maybe it's something wrong with me that I'm doing, or I don't have some type of quality in order to be a good therapist. So this leaves a fearful therapist in like these impacts that aren't necessarily true. So what usually ends up happening is when those thoughts are happening for a therapist of, I don't have the skills, I don't have the confidence, I'm just not good at this, we start to avoid cases or situations. So we won't want to take certain referrals, we won't want to work with certain people, because we feel like we're not a good fit or not good enough. And there's sometimes where we don't have the skills and it's our ethical obligation to say, I have no training or skills in treating this and I need to refer it on to someone else. But this is more of an avoidance issue where the therapist just doesn't want to take certain cases because they don't feel like they have the skills or the confidence to work with them. Then getting nervous in supervision or consultation because they feel like what if my supervisor or the person I'm doing consultation with, what if they say I'm a terrible therapist or that I shouldn't be in this field? And some of us have come from training programs or experiences where we've had supervisors that were really difficult. In my grad school training, this was back in the 90s, when we had a two-way mirror, and I would face the mirror and the client would have their back to the mirror, and there was a phone that would go in between. And I was in a very behavioral program, and the supervisor that I had at the time was very behavioral, and she used the call button between to signal how off she thought I was. So if she wanted me to change my strategy a little bit, she'd do a light beep. And if she was upset or was just kind of frustrated with me, she would lay on that buzzer. And the client got to the point where she couldn't see the client, and the client would go, roll her eyes like, oh boy, you're in trouble again. So some of us have had situations where supervision and consultation have been difficult for us to take because of how it plays out. But sometimes we just get nervous in it because we feel like we may be judged, or somebody may say that we're not a good therapist. The fearful therapist also may feel inferior with colleagues. So when they discuss cases or discuss different theories or books, they may feel like they're not at the same level as their colleagues. One of the hallmarks is that they start to avoid parents of child and teen clients. So when you're dealing with intergenerational trauma, the whole family system is impacted, and it can be really, really difficult. Most people in intergenerational trauma situations, a lot of those cases when they're coming in for therapy, they're really hurting. So they'll come in, they'll be frustrated, and it can be pretty overwhelming if you can't stay calm, regulated, and confident in dealing with the parents that are frustrated with the child, and then wanting you to address it and get it kind of fixed in a small amount of time. So there's some really tough cases that can really have an impact on us, but then we start to avoid those parents of the children and the teens, can end up reading more and more books and thinking the next book will help us, and I have to have this book to make things better, taking more trainings, getting more certifications, but they still feel fearful and they still feel like an imposter, and it doesn't go away. And it's because they're not hitting the right points and not developing these skills as a master, calm and confident therapist. So a fearful therapist may think, I don't have enough experience. And experience, a calm and confident therapist knows that experience doesn't always help, especially not if we get too comfortable or quit trying to grow. So sometimes once we've reached a certain point, we feel like we've developed skills and we just use those skills over and over. And it can be okay, and if we're continuing to master and grow those, but sometimes our growth as a therapist becomes stagnant. But a calm, confident therapist knows that it's important to continue to get experience, but it's not always about the degree of experience that you have. And sometimes the experience that we do get might just be developing bad habits. So that's something to watch for as well. So a fearful therapist may have to find the best intervention, master that one intervention, where a calm, confident therapist knows that there isn't one best intervention, but there's a way to use various interventions to maximize effectiveness for those masterful outcomes. So this is where interpersonal neurobiology becomes really important. So how I use this in my practice is there's 9 domains of integration. This is a little too long to get into deeply in this live stream, but there's 9 domains of neural integration. And I look at IPN, interpersonal neurobiology, as kind of the umbrella or framework to know which intervention to use when. So an example of this would be when you look at integration of left and right hemispheres. If somebody's really logical, gets kind of caught in their thoughts and words and kind of rigid in their thinking, interpersonal neurobiology would say interventions that are more art-based, sand tray, expressive in nature will help integrate those 2 hemispheres. And conversely, with someone who gets caught in really strong emotions, really overwhelmed, kind of can't put language to it, that's a lack of integration of left and right, that the interventions to use would be like CBT, some of the DBT skills that are more cognitive in nature. So it all becomes about integration. So it may not be about finding the one best intervention. It may be knowing how to use what you're taught in a certain framework and with a foundation that we're going to talk about in a few minutes here. So a fearful therapist may think that the therapy technique is most important and they really have to get the technique down right by the book. And a calm and confident therapist knows that when we become too focused on the technique, we lose sight of the therapy relationship. So we get too focused on how that intervention is playing out that we're not really paying attention to the relationship itself. The client may not even resonate with that technique. So that therapist-client relationship across all interventions is the transformative factor, and it's the most important part of therapy for most clients. So many clients are living in worlds where they aren't seen, they're not heard in their daily life, that to come into therapy and have somebody that kind of knows them and understands and sees what they're going through sometimes that's what they really need, along with some of those skills and techniques that we do have. So the fearful therapist thinks that confidence is the one thing I need to be more effective. But the calm and confident therapist knows that confidence is actually the outcome of being a master therapist. It's not the requirement to be a master therapist. Confidence is the outcome. So it comes from a system to guide you to understand your reactions, to understand the client, and to use your own reactions as a resource rather than taking meaning about yourself. A fearful therapist may think that they don't have the qualities or strengths to be a good therapist. So the most important characteristics of master therapists across all interventions, across all theoretical backgrounds, is this interpersonal neurobiology idea of part. So it's presence, attunement, resonance, and trust. So these skills are what help you transform into a calm, confident master therapist. And I'm going to teach you how to do that with interpersonal neurobiology and polyvagal theory. So the impact of adopting this approach and becoming a calm, confident therapist is you can attune to your own responses and reactions. So you know that when you're in session and you have a certain kind of, it's like an antenna or radar that you can start to tune into yourself to know what's happening in the therapy relationship. And if you've done any training with Lisa Dion, she talks about how the client will kind of hook you into what they're feeling, but you're going to be feeling it. So it's about being authentic in what you're feeling. So it's really about attuning to your own responses and reactions, using those twinges of, uh-oh, what am I going to do? This is pretty big. This is difficult, to explore deeper. So it becomes leaning into these difficult situations instead of avoiding them or pulling away. So when you get that deep, like, oh no, or this isn't good, or what's going to happen, I'm going to have to kind of look at my strategies. Leaning into that difficult situation is really important, rather than kind of pulling back and getting more about the skills or the technique or the intervention. It's also collaborating with parents and being able to work within the family system to support all the people who are impacting maybe the one client that you're seeing. So you'd also, the calm, confident therapist also feels really confident and great interacting with colleagues and supervisors. It becomes stimulating, exciting, and really good to be able to discuss cases with other people and get their ideas and opinions, but without feeling like you're an imposter or you're not a good enough therapist. The calm, confident therapist also engages in self-care. So this has become a really difficult one for a lot of the therapists that I talk with, because with the pandemic, there's been so much pressure on us to be able to provide these services that sometimes we schedule longer, schedule at hours that aren't the best for our effectiveness. We take too many cases because the demands and the difficulties are so high right now. But in order to be that calm, confident therapist, that self-care has to be in place. And with difficult cases, a calm, confident therapist has like a mindful curiosity. It's not this pulling back of, oh, I don't know if I have the skills to work with this case. It's more of a, oh, I wonder what is happening in the school environment or in the home environment that is causing this behavior to show. So that is how a calm, confident therapist can transform if they use this presence, attunement, resonance, and trust. So that is how we become a calm and confident therapist. So this is like a resilience-based psychotherapy. It combines interpersonal neurobiology and polyvagal theory. And again, this resilience-based psychotherapy, these two pillars are two of four pillars in the intergenerational trauma program, where it includes interpersonal neurobiology, polyvagal theory, child development, and family resilience. So interpersonal neurobiology is combining neuroscience and relationships to promote growth and healing. So it's really knowing the brain, brain development, neural integration, and how relationships can link those two and can really help maximize that neural integration for growth and healing. So it's using relational neurobiology to guide our sessions. And then polyvagal theory, this really is the foundation for all therapy interventions, regardless if you're really behavioral, psychodynamic, DBT. Polyvagal theory is so important for every therapist to have as a foundation, because it increases therapist attunement if we're aware of what's happening with ourselves, and it helps give us this presence. It helps co-regulate clients during difficult and overwhelming situations, and it really helps them see the difficulties that they're having are really probably adaptive responses to really difficult situations. So relational neuroscience, or interpersonal neurobiology, Daniel Siegel works with this part. So it is presence, attunement, and resonance. So your presence in therapy, your mindful awareness, you're being actively engaged in the session rather than, oh, I wonder how much longer till lunch, or, oh, this is so overwhelming, I need to talk to my supervisor about this. It's being fully focused and aware. And attunement is being attuned not only to ourselves, but also with our clients. So we can pick up little tiny shifts or changes in their presentation and maybe notice, wow, it looks like that's really difficult for you, where they may not even be aware that their eyes are starting to well up with tears, or they're starting to breathe a little bit differently, but we can help support them in that process. And then resonance is more the energy between people and the energy that you kind of give off. So one of the things that we try to do to have a lot of resonance is when people come to the waiting area and we're getting ready to start a session, we don't just go out and say, hi, come on in, and kind of flatten that. We'll be kind of excited and light up to see the person, because first of all, we really do like our clients and we enjoy working with them. But it's good to have that resonance right from the start, and to have that energy to kind of show that you're fully actively engaged and you're giving kind of unconditional positive regard to the client. So when you add presence, attunement, and resonance, what happens is there's a really significant development of trust. So clients really feel seen, safe, soothed, understood, and they can have more engagement and feel more comfortable in the therapy process. So now we're going to look more specifically at what presence is. And there's about 6 characteristics of it that we're going to work through. First is trans-theoretical. So presence is important in any theory that you're working with, whether it's CBT, DBT, psychodynamic, polyvagal. It is part of polyvagal theory. Whatever type of intervention or theoretical framework you're working from, presence is an important component of that. So it's the basic building block of the therapy relationship, is to be present and aware of what's happening in the session, what's happening for the client, what's happening for yourself. It also transcends, so it goes a lot deeper than being physically in the room with a client. So if we're human beings, you've probably had sessions where you've had maybe a crisis in the session before, and you're hoping you're kind of going through all the things that you were supposed to do to make sure the person's safe and reviewing the safety plan in your mind. You can't just be physically present in the room, but your mind is kind of elsewhere, focused on other things. It really has to be fully embodied and present in the moment in the therapy room. So it's not just your physical presence, it's kind of your emotional, relational presence as well. It's also very resourceful. So it's based on the inner resourcefulness of the therapist to draw strength from within. So because we are human, we have days where we're not at our most effective, and you can probably tell that sessions may not go the same as they would as if you hadn't had that stress or a poor sleep the night before. So it's really about harnessing that inner resourcefulness and making sure that you're drawing strength from within yourself, your own reactions, your own experiences in the therapy session. It's also about openness. So one thing that can happen when we get in difficult clinical situations, and sometimes there's cases where we have to be more directive, more like cases of suicide, homicide, crises, that kind of stuff. Sometimes we have to be more directive, and we have to be able to have firmer boundaries and more guidance for the client's safety and welfare. But in general, in therapy sessions, that presence helps us have an openness to possibilities. So things will unfold in therapy if you allow the client, if you're present for the client and allow that process to take hold rather than guiding and directing. And sometimes when we start to lack confidence, when we feel fearful, when we feel tearful, we can start to get more where we're guiding and directing, almost like we're having a course or teaching a class rather than providing therapy. So there's an openness that you can experience with presence that allows things to unfold. And that's kind of that magic in therapy when we can provide this environment for a client and then they start making all these connections where if we're guiding and directing and not open to the possibilities that can happen, the client may feel like that's not what therapy is about and they have to kind of follow this structure. Not that we can't be structured as well, but we have to have that openness. Presence is also resilient. It creates greater resilience both inside the therapy room and outside the therapy room. So if we have had a session with somebody that feels like they're not safe, they're not heard, nobody understands them, we're fully present and aware, we're attuned to them, that they leave that therapy session feeling like a different person or different experience, which then allows them to connect with other people in a different way where they may be able to receive that better when they're outside the therapy room. So it creates a lot more resilience for the therapist as well, because we're not trying to corral a client and get them to follow a certain framework. We have our framework that we work within, but it's also having that flexibility and openness. So it becomes less stressful for the therapist and more effective for the client. It's also refreshing. So it's quite a different approach than being very directive. If you're teaching courses and classes and doing psychoeducation, you can still have presence and still have that mindful awareness of what's happening, but it may look a little bit different. So this should still be the foundation, and it should be quite refreshing if you're working from a more directive approach that you get a lot of pushback from clients with, because this will help kind of transform that pushback and help kind of build that relationship so that maybe they're a little more receptive to what you're teaching them. So is it easy to have therapeutic presence? It's not always easy. It's difficult if we have challenging clients. So if we work with a challenging population, which can be substance abuse, can be correctional environments, can be complex trauma, can be highly suicidal, really challenging cases can be really difficult to have presence with. On the flip side, if you're used to those types of challenging clients and they become the norm that you're working with, it may be challenging for you to work with people that are struggling with meaning in life and feeling less less impacted significantly by difficult life circumstances, but just in kind of life transitions. So it kind of depends what your background and experience is in, because sometimes it's the challenging clients are a little easier to work with because there's a lot to work with. It can be very difficult with parents of children or teens because they may be, specifically if they have intergenerational trauma too, because they may have a high need to have some type of behavior or something rectified or shifted in the situation so that they're not as stressed as a parent. So they can put a lot of pressure on the therapist. They'll say things like, you need to fix this kid. I can't stand this anymore. How long is this going to take? When will therapy be effective? There's going to be a lot of pressure on the therapist. If you have really high caseloads and don't have the time to kind of emotionally process and deal with what you need to deal with as a therapist, or if you're balancing business and practice, sometimes the therapeutic part of being in a private practice doesn't necessarily blend well with the business aspects and setting boundaries related to attendance, payment, all those kinds of things. So that can get really difficult in different circumstances. So let's take a deeper dive into presence. So there's 5 characteristics of presence. It's being receptive. It's related to the therapist's inner experience. It's relationship-based. It promotes growth, and it provides the neuroception of safety. And that's a polyvagal concept that has to do with kind of the implicit or unconscious awareness of safety, threat, and danger. So with being receptive, it's about attunement to the client. So you're aware of their verbal and nonverbal signals. That it's a great awareness of how they're shifting when they move into talking about something more difficult. I had mentioned before, like eyes tearing up, having trouble finding words, things like that. It's being highly attuned to that. Grizzly's getting attuned to something in the environment because she's starting to walk around. It's also about self-attunement. So it's about attuning to your own responses and reactions to kind of access like this implicit wisdom. So when we feel like when a client expresses something that's really upsetting and difficult, and we kind of can feel the pit of our stomach, I've sometimes said, oh my gosh, I can like feel the pit of my stomach when you talked about that. And they'll say, that's exactly how I felt at the time. Or they'll say, I know it's so difficult. So it's attuning to yourself and using your own resources, your own responses as a resource and finding that inner guidance. It's also being in contact with clients' emotions and allowing space for these. And in some cases, that's a lot easier than others. So if clients are in a lot of distress, if they're in the middle of a panic attack, if they're really angry, it's hard sometimes to stay in contact with that. And our job is to make those things better. So we get where we get kind of like, I got to get this to go away, or I've got to get them so they're not angry, or got to get them moved out of this panic attack. And sometimes it's just making contact with that emotion and allowing it to be felt and allowing it space. So the idea of inner experience, it's guided by attunement. It's your own experiences and the client's experiences, and they're related to that client's situation. So these can be one of your most powerful resources if you're able to tap into and attune to both yourself and the client. It's also a deep awareness. So it's being really deeply in contact with the client's pain or joy. However, because we're dealing with such deep, difficult things sometimes, and with so many clients, we also have the boundaries where we're not taking it on ourselves, or we're not taking it home with us. And there are clients that we will always worry about because of their situations. And we have to make sure that we use that as a resource to make sure that any kind of safety plan has been addressed. But it's really, we need to feel comfortable also having boundaries, because that serves their need for healing. If we take on everybody's emotions without boundaries, we will end up not having self-care, and we'll end up not being emotionally healthy enough for ourselves, let alone our clients. It's also about being compassionate. So there's a concept in polyvagal theory where Dr. Porges talks about the difference between empathy and compassion. And empathy is feeling what other people are feeling. So when somebody feels sad, I feel the same kind of sadness. If somebody feels scared, I might feel a little bit fearful. And the problem with that is when it comes to neuroception. So if I'm empathic in feeling what other people are feeling, then we may end up giving off signals that things aren't safe when the client wasn't in that space. So the alternative to focus on would be a lot of compassion and moving beyond that pain and suffering with compassion in order to create a space for healing. So it's knowing it's there, it's feeling deeply moved by it, but it's not feeling the same exact emotion, and really getting into the experience of that emotion with the client. Presence is also relationship based. So there's this synchronicity, that or sense of timing in therapy that's really attuned to the needs of the client. So it may be that you have some time to talk about something in the beginning, and then introduce an intervention, and it's in synchrony, so it really flows well, which is the next characteristic of the relationship-based foundation of presence, is that there's this freedom and flow that will happen. There's not uncomfortable silences. There may be periods of silence, but they're not uncomfortable. So it's just this synchrony, there's flow, and there's a connectedness. So there's a lot of harmony. And that just kind of continues this almost sacred reciprocal relationship, that there's just this flow and connectedness that happens when we are relationship based and use a lot of presence. It also promotes growth. So the neural integration will happen when a relationship supports this natural process. So if a person gets very literal and this isn't right, and the rules are this, and this person's violated these rules, and they get really rigid, if we provide that presence, they're more able to get over into that right brain response of maybe feeling it or seeing the larger picture, seeing it as a whole. So having presence in sessions really helps support that neural integration. It allows things from the vertical integration, which are top down, bottom up, where they may be not able to experience some of the bottom up memories, strong emotions, that kind of stuff that they really need to kind of connect with the way that they think about a situation. But they can do that in a session where the therapist has presence and there's this kind of reciprocal relationship happening. And those 4 S's are from interpersonal neurobiology and a little bit of polyvagal with the safety. And it's feeling safe, seen, soothed, and secure. So part of therapy can help clients develop like an earned, secure attachment that's healthy to a therapist, that allows them to experience a healthy relationship so that they know what that is when they're out in the world and have relationships with other people. Not that we become their primary attachment, but we are a foundation of a different attachment experience that helps them earn security in relationships. And then ventral vagal growth is part of polyvagal theory. And the ventral vagal part of the vagus nerve is that is what helps someone feel connected and a sense of safety or well-being. So it really supports, this presence supports that social engagement system to relax any defenses and promote healing. So it's really important. And now with neuroception, so the therapist presence is directly related to the sense of safety in therapy. So if somebody's talking about something, clients talking about something really difficult, really traumatic, and the therapist is just kind of maybe not feeling well, not really present, it kind of signals to that person's neuroception that this isn't safe and you probably shouldn't continue. It doesn't happen like that, but that's kind of the outcome. It's also based on nonverbal communication. So it's your posture, it's gestures, it's vocal tone and rhythm. So having a lot of expression in your voice. So these are all really important things to include in presence to have that neuroception of safety. And it's the foundation that promotes a sense of safety. Presence is all about safety, compassion, and understanding, which is the container that people need for healing. They don't need our paperwork, our workbooks. They need that container in order to use those papers and workbooks and interventions effectively. So this is the first part of relational neuroscience, the presence, attunement, resonance, and trust. And next Monday, I'll be doing a live on attunement. And so this week in the Facebook group, we'll have posts that are for discussion related to presence, and we will be going through all that. So that is the live stream, and I'm going to see, looks like there's some comments. It doesn't have the person's name, but they said thank you for this, and you're very welcome. This is a time where we really need to come together and be supportive of each other as therapists. And I know some of the Facebook groups on Facebook have gotten kind of really cutthroat and difficult, and that's not a space that I'll hold here. I want a space for therapists to gain this calm, confident, masterful therapist kind of way of being. So thank you for attending, and I hope you have a wonderful day.